I have to tell him he's on his way. So basically, Jeff, he hit me up like about a day or so ago, talking about the infection rate of COVID. And so he is a data scientist. I'm sorry, a data engineer. He's a data engineer for a digital mapping company. And he's been analyzing the spatial statistics for COVID-19 and modeling the rate of spread for the CDC and public health organizations all across the country. Is he on the line right here? Is he?
Hey, can you
Yeah,
guys
I
hear
can hear
me?
you.
Hey, Derek, thanks for having
Yeah,
me on.
man. Good to see you. So yeah, I was just giving a brief introduction about you. If you want, go ahead, reintroduce yourself. Tell us why you have some valuable things to say.
Yeah, sure. So my name's Jeff Pearson. I work for a major data company here in the United States. I'm specifically out here in Denver, Colorado, and I look at modeling the spread of the COVID-19 virus spatially, right? So I'm looking at not only um, sort of who is infected, but where they are, how fast it's spreading, and sort of where it's sort of going to, right? So I'm looking at all that data and making maps for it essentially. So yeah, I think it's pretty cool job for sure. I get to work from home, like you were saying.
Oh,
I'm one of the lucky
oh,
ones.
you get to
So
work for
yeah.
yeah. So yeah, like I was saying, a lot of people that are on salary right now, they have some form of job security, and they're able to kind of make this transition a little bit more smoothly than others. The people that actually really need it the most. So, what, in your opinion, are we missing that we're not seeing from the information we're being given by the media, right? You get to see the numbers, you got raw data, and you have a lot of it. So what are we missing publicly that we need to be seeing?
So one thing that people don't understand is that how these models are actually being run are actually supposed to be in what's called a SIR model. So how they're looking at the population the of the people that are infected, how many people that have recovered, so on and so forth. And what the media is definitely missing is they're not accounting the people that have gotten the virus and have been infected, say in January, right? So right now, I think it's saying that there's like 180,000 people in the United
Yes,
States or something like that.
118.
They're not looking at the people that have been infected and have been cured, essentially, right? It's they've actually cycled through it, right? So if you got sick on January 2nd, it's about an 11-day turnaround as per the World Health. On January 12th, your number should come off of that ticker, but it's not.
Okay.
So there is no curve. So when you look at all these charts and these graphs and they just keep on going up, 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 like that's not accurate at all
So you're
whatsoever.
saying that the infection rate is less than what's being told?
Yeah, so a lot of my models, and I'm not saying that it's not a big deal, it's still a very big deal. There's
Okay.
still a lot of very sick people. So all the viewers that are watching don't think that it's not a big deal. It definitely
Okay.
is. But what I'm saying is that there's probably about 60% of all the numbers that you're seeing, you basically almost cut it in half, and that's the real number that I'm seeing about, right? And it's a give and take based on location, right? So if you're an older person, um, that 11-day average actually turns into about a 23-day
That makes
average.
sense.
So if you're in South Florida, if you're in, Arizona with these major sort um, of these elderly people, that curve is going to be a little bit more steep because those people are sick for longer. Does that make
Yeah,
sense?
and you know what's funny is that you're talking about January. I got sick earlier this year, and it was something that I had never felt in my entire life, and it felt like the flu, but it was something so much worse. And I don't want to speculate or whatever, but if I had to say, I would say it was that. It was damn coronavirus because I have no idea what else it was. I've had the flu before in my lifetime. I think I got two flu shots this season from the VA. I got one like early, like in like maybe August, September. And then I think I had got another one maybe December or so. They told me to get another one. But yeah, I got sick and it was something that I had never felt before, and it lingered like for like you said 11 days kind of thing. Like it stayed with me. So I don't know. It's ironic that we're here now. So okay, so what should we be doing? You know, even knowing what you know, what are you doing to protect yourself, and what are you telling other people to do to protect themselves?
So I haven't left my house in 3 weeks, and that's what I am recommending. Even though, I think a lot of these, major population areas have just gone under curfew and these major quarantines just recently,
Right.
right? I've been taking this very seriously, for the last about month, right? So I'd say definitely stay inside. Limit any and all contact. Don't be touching surfaces. Wash your hands. My guess is that I don't think it's going to last as long as what everyone's saying because of the
So
modeling,
like less
right?
than two
Like
months is what you're saying?
I I would I would go ahead and say on the record that I would guess that this is going to be over within probably 6 weeks is what I would guess. And I'm not a sociologist, right? So I don't know how people are going to react,
Yeah.
right? As we see, us at the top of the actual bell curve and then coming on the way down,
Yeah.
is that going to be reported? How are people going to react? I don't know, but a lot of my models are showing about 6 weeks, and that's on the short end, about 8 weeks on the long end. And that's sort of what I'm looking at right
So
now. I also,
what are we looking at as far as like potential for this being seasonal, and what are the reinfection rates? Can you be reinfected?
that's actually a really good question.
Yeah.
So, what a lot of really smart people are trying to figure out right now is you need to remember that it's called a novel virus for a reason, right? We don't
Never
know
seen
anything
it. Yeah,
about it.
never seen it before.
They are looking at COVID-2, which is the SARS virus, and they're looking at influenza, right? And they're looking at sort of looking at those stats. They're looking at something called typhoid
Yep.
fever because it's on the same sort of model. And I'm not a doctor, I'm not an epidemiologist, but I predict that this is going to wind up coming up, probably yearly,
Cyclical.
right?
Yeah.
And yeah, I could definitely see that happening. I am like kind of what you were saying earlier. I am a little bit more worried about the economic impacts. Unfortunately, I say it's a bad problem to have, but I'm in that bucket of people that will not be getting a check, right? Because I'm above that, sort of threshold. And $2 trillion is a lot of money, right? I was just watching this I think it was like a Now This
Mhm.
video where they were showing these big piles of rice with a million, 100,000, a billion, and it's like huge, right? So it's kind of hard to wrap my head around $2 trillion. It's a lot of money for sure, and I hope that the people out there that need help are able to get that from their state government or federal government, or I haven't read the actual bill yet, so I don't know what's in that package, like what agencies are sort of getting you
Getting
know
what?
billions of dollars or whatever. But I have a lot of friends that are struggling, that they were struggling way before this happened, and now they're really in a lot of trouble, and I try to help them out as much as I can because I'm fortunate,
Yeah.
right? Like I make a lot of money, and I'm able to work from home. So yeah, I definitely feel bad for a lot of those people for sure.
That's the unfortunate. That's like the gift and a curse part of this whole thing. It's like it's exposing the cracks in our social safety nets. What was left of them, right? And so now we're able to kind of see in real time. Yes, the majority of Americans had no emergency money. They have no emergency fund. They have no way to take care of themselves in times of crises. And we're also realizing that businesses are living paycheck to paycheck as well. So it's not even just that
Yeah,
employees are living paycheck to paycheck. Now we're realizing that employers have been doing that as well. I think of all the banks, all of the major banks that are, they have mortgages and stuff like that. With the exception of Bank of America, the majority of them said that they would be able to go up roughly 4 months with a moratorium on collecting those things, right? That they would give people opportunity to do that. Bank of America said they could only do 30 days. What does that tell you? Right? And it's not that they and
yeah,
it's not even that they don't want to, it's they can't. because they would become
Yeah.
insolvent, right?
Yeah, I definitely try to bank with private banks and non-publicly traded banks as much as I can. Unfortunately, that's kind of unavoidable at this point, but it's definitely sort of telling. But on the opposite end, right? Like I'm definitely a little bit more leaning towards you know, I understand both sides, right? I understand why banks need these bailouts and these, airlines need the bailouts, right? There's like 15 million people that work for, the actual airline industry. And if they go under, then that's 15 million people that's,
So
going to be out of the
so
job.
what do you think about the idea of nationalizing the airlines, especially given what they're asking for now?
I, so basically having one major entity, a federal or a state entity,
Or I mean,
in
it
charge
could
of the
I mean, it could
airlines?
still be more
Is
than
that
one. I
what the
mean, you
question
could
is?
still have like the FAA, but it could yeah, yeah, you're good. Oh yeah. We're at in the oh yeah. It's so sorry. The You
No
could
worries.
have the FAA still govern more than one airline. So let's say they keep the major ones that we have now. You know what I mean? Like,
Yeah,
and
yeah,
then,
yeah.
but the idea is that they're coming to us asking for bailouts and all this stuff now because they didn't do the proper precautionary measures to ensure that they had the resources necessary when this happened, right? So they,
Sure.
first of all, when we bailed them out the first time, instead of taking all that money and leaving it liquid, keeping it as cash, they decided to buy back all their stocks, which inflated their stock price, which meant that the executives at the top qualified for whatever line item bonuses were written into their contracts. And so
Mhm.
now a host of people that got free government money in the first place got bailed out, got saved, they got rich, and now they're coming back, leaving us with another bill so they can do it all over again. So I think that's the idea.
Yeah.
How do we break that cycle?
Yeah.
I'm listening
Yeah.
to you. 1 second.
And sure. And that's definitely a big problem, right? Like I'm not um as a veteran, right? I I use, the VA system, right? And I look at government ran systems like that. I also used to work for the federal government as a civilian. I worked as a scientist for the Federal Highway Administration as well as the United States Geological Survey. And I could definitely say that private industry is much more efficient and they're much more effective at doing things than the federal government is.
Yeah.
Because there definitely are good federal employees for sure, but regardless of what happens, they know that they're getting a check,
But
right?
but do
Like
you
it doesn't
yeah.
matter if they're performing, it doesn't matter if they're not. Like they are guaranteed, right? So in the private industry, I've worked in the private industry now for this big company for about 2 years, and if you're not pulling your weight, man, like that's it.
Right.
Like you know what I mean?
Well, so that was
So
one of the things that I think is like the downfall of the government is that how do I say this? The a lot of times the best people they'll go to the private entities because they're offering better benefits, like higher salary. Sometimes they have like more robust, like vacation packages and healthcare
for
and
sure.
whatever the case may be.
Hmm.
There is a job security with the government, but I just think oftentimes it's like, for instance, in the airline industry, if the airline industry is nationalized, well, then everyone who works in airline, the best of the brightest, they're there. So what you're talking about, getting things done and having like more efficiency and stuff like that, it would inherently be already in that system. You know what I mean?
Oh, I see what you're saying. So you're saying that all the employees that are good in that sort of job or whatever, you wouldn't anticipate them leaving is what you're
No, like
trying to
if I'm an
say.
aircraft mechanic and I'm the one of the
Uh-huh.
highest paid in the nation, and so I decide to go work for
Hmm.
Boeing because, right? Whereas I could, if it was all nationalized, maybe the not the means of production, so that person may still work for Boeing building the aircraft, but maybe there's a job that has commensurate pay with commensurate benefits that maybe they just would rather work for the government as opposed to a for-profit corporation on the outside, right? So now that person has like, it's a better avenue, a better working environment, I would imagine, if everybody's in the same boat instead of competing between private and public sector. You know what I mean?
Sure. Yeah. And sort of with my experience, being a veteran and working for the federal government, like I'm like I was good, right? Like there was basically no way. At the time, I was I think a GS 11. I had just made GS 12. So that's pretty good money, right? And I basically couldn't be fired,
Yeah.
right? But the private industry, just the comp is so much better, right? It's literally like it's apples and oranges, right? It's
Yeah.
not even apples and oranges. It's like apples and dogs, right? That's how far off it is. And you know, in the private industry, if you don't perform, then you do get, fired. But I'm not really worried about that because I know that I'm a top performer. I know how good I am, and kind of understand that value.
Right.
And I see a lot of people struggle with that when they're trying to leave the Air Force or the Army or whatever, is because it's a guaranteed check. And I know you took that leap, and it's a very scary thing to do. And I know you know what
Yeah.
I'm sort of talking about.
Yeah.
A lot of my buddies that are still in, I try to convince, hey man, like the grass is greener on the other side for a lot of people as long as you're willing to put
You
in
got
the
to put a
work,
lot of
right? And I
work,
think that's
man.
what it's a
It's a
lot of
lot of
work for
work.
sure. Like
Eh, eh,
like no one's gonna
yeah.
hand you anything, and
Yeah.
yeah.
Yeah,
So
like yeah, there's a lot of benefits, but I mean, you definitely have to work for them, and I think that's the I don't know. I guess that's the overarching lesson for this entire thing as well, right? It's kind of like before I left the military, I had like a rainy day, not only just fun, but I had like a plan. Like I had an idea
yeah,
of what I needed to do to sustain myself without these guaranteed benefits. And I think that like in the same fashion now during this whole pandemic, I think a lot of people need to like take a moment, sit back, and really look at, okay, what did I not prepare preemptively that is causing me stress now? And what can I do in the future to kind of like change the trajectory? Because this is going to happen again. Some form of disaster in your life is going to happen, whether a fire to your home, a medical bill for a loved one just puts you in a bankruptcy situation, car crash, like all kinds of stuff can just derail people. So, you know, hopefully in the future, by having these discussions and by people just internally reflecting, they'll be able to kind of be on a better path. So, anything else you have to add to the discussion? I'm going to transition out of here pretty soon. So,
sure. Yeah, no, I just want to say thanks for, inviting me on here, and anytime you want, I'm happy to come
yeah,
back.
for
So
sure, man. I'll
thanks.
definitely have you back. I appreciate you coming in and dealing with all the difficulties we had earlier, but I appreciate you sticking through, man.
No worries.
All right,
Thanks a
thanks for
lot.
your time. So we go ahead and kill that.